Using the Apple Watch during injury recovery represents both an opportunity and a risk, and understanding the difference could mean the difference between successful rehabilitation and re-injury or prolonged recovery. The principle of adjusting your goals when recovering from injury is absolutely correct. Your pre-injury activity rings are no longer appropriate targets. Continuing to pursue them will either lead to re-injury as you push too hard, or to frustration and feelings of failure as you consistently fall short. The watch allows you to customize your targets, and this flexibility is valuable during recovery periods. The suggestion to stay in a low heart rate zone during recovery is generally sound advice for certain types of injuries. Keeping cardiovascular activity at low intensity maintains fitness without overstressing injured tissues. For injuries that require rest from high-impact or high-intensity exercise, walking or gentle cycling in Zone 1 or 2 can help maintain aerobic capacity while tissues heal. Gradually increasing activity is the foundational principle of injury rehabilitation. You don't go from injured to fully active in one jump. You progressively load the injured area, allowing tissues to adapt and strengthen. The Apple Watch can track this progression, showing you whether you're maintaining gradual increases rather than making erratic jumps that risk setback. The watch's data can also help you identify patterns that might indicate you're pushing too hard. If your resting heart rate starts creeping up day after day, this can signal inadequate recovery. If your heart rate is disproportionately elevated during activities that used to be easy, this might indicate you're not ready for that intensity yet. Having objective data can prevent the common mistake of letting enthusiasm override physiological readiness. However, here are the critical warnings. The Apple Watch is not a medical device and cannot diagnose injury or tell you what's safe during recovery. If you have a significant injury, you need evaluation and guidance from a healthcare professional, ideally one with expertise in sports medicine or rehabilitation. The watch can complement professional guidance, but it cannot replace it. Different injuries require dramatically different recovery approaches. A stress fracture requires complete rest from impact activities. A muscle strain might benefit from gentle movement within pain-free ranges. A ligament injury might need specific strengthening exercises. Generic advice about low heart rate zones and gradual increases doesn't account for these crucial differences. There's a significant risk of using the watch's data to rationalize returning to activity before you're ready. If your heart rate seems fine and you're closing your rings with modified activity, you might convince yourself you're healed when you're actually just compensating. The watch measures cardiovascular response and movement. It doesn't measure tissue healing, structural integrity, or neuromuscular coordination. Some people become overly cautious during recovery, afraid to do anything that might cause setbacks. For these individuals, the watch's data can provide false reassurance that any activity is dangerous if it elevates heart rate or causes mild discomfort. Recovery from most injuries actually requires progressive loading and some discomfort. The watch can't tell you the difference between harmful pain and the discomfort of therapeutic challenge. The safety checklist infographic presumably includes points about pain monitoring, rest days, professional consultation, and gradual progression. These are valuable, but checklists can create a false sense of security. Injury recovery is complex and individual. Two people with identical injuries might need different recovery protocols based on their healing response, previous injury history, and specific circumstances. One often overlooked aspect is the psychological dimension of injury recovery. Being injured when you're accustomed to regular exercise can be frustrating, depressing, and anxiety-provoking. The Apple Watch might help by showing that you can maintain some activity, or it might make things worse by constantly reminding you of what you can't do. Your rings won't close the way they used to, and seeing this daily evidence of reduced capacity can be emotionally difficult. The most responsible advice is this: if you're recovering from injury, work with a qualified healthcare professional to develop an appropriate rehabilitation plan. Ask them specifically how you should use your Apple Watch during recovery. Some might recommend adjusting rings to match your prescribed activity. Others might suggest not wearing the watch at all during early recovery to remove the temptation to overdo it. Follow their guidance, not generic advice from articles or the watch's default suggestions. Your injury is unique, your body is unique, and your recovery needs to be individualized to be safe and effective.